There is a direct link between your oral health and your children's. According to dentist Dr. Haas, we talk about the impact, especially if you are pregnant or if you're in postpartum.
Anyone else who is maybe getting pregnant this year in 2022, what should they be looking for as far as what's going to happen with their oral health?
I think with all the things that moms and dads do to get ready for their baby, I think sometimes their oral health and going to the dentist and taking their mouth is neglected. And unfortunately, that's not really enforced even by the dentist, by the physician, because of lack of education on their part, and the fact that there's some the guidance isn't there. Sometimes dentists are reluctant to work on pregnant women, which is really the wrong thing. So my advice to them is to take care of your mouth, because taking care of your oral health is one very important way that you can be taking care of your baby.
Can it actually impact fertility or infertility issues, your oral health?
Yeah, the moms and the dads' oral health impacts really everything from pre-pregnancy, because the poor oral health in moms have been found to affect fertility, causes infertility. In dad, it causes lower sperm count and the quality of the sperm and the motility of the sperm. So that's pre-pregnancy. It impacts fertility in a dramatic way. Then during pregnancy, oral health of mom, both from microbial perspective, the microbes in their mouth, and also the airway, because it's related to oral health. It impacts the development of the fetus, but it also impacts the health of the mom during pregnancy. For example, poor oral health can lead to preeclampsia, which is one of the potentially very dangerous complications during pregnancy. It can lead to gestational diabetes. For the baby, it can lead to preterm birth or low birth weight, which can have both short-term and long-term dramatic impact on the baby herself or himself. And then post-birth, the microbes in both the mom and the dad and all the caregivers around the baby would be passed on to the baby. So if they have good oral health, those good microbes would get passed on, and that gets seeded in the baby's mouth as the baby's oral microbiome is evolving and maturing. And if the bad microbes are there, those are going to get passed on as well.
Is that through like kissing the baby and things? Or I could see the mom, but
yeah. Through really everything. First of all, through the birth canal, through the birth, that's the first dose of the microbes that the baby gets. And then through breastfeeding, through kissing, through just touching, skin, touching the baby. Baby gets, that's actually, so a baby doesn't have any microbes in the body, but once they're born, they get really, they just get a dose of all sorts of microbes from the birth itself, from breastfeeding, from the caregivers around them, the parents, siblings, nanny, grandparents, even the house pets. If they have all good oral health and they take care of their mouths, that's a great thing for the baby, because they develop a wonderful, balanced, diverse microbiome.
I had no idea. I did want to mention, you mentioned something about dentists not wanting to work on women if they're pregnant sometimes. What can be done? What trimester should you be going in to have some work done if you have a cavity or need x-rays, that sort of thing?
Great question. So the best time to get any elective treatment done is during the second trimester and the first half of the third trimester. Although if you have any emergency, you should always go to the dentist. And this is why it's so important to take care of your mouth before becoming pregnant, because you want to make sure that you don't have too many major restorations throughout your pregnancy. But always during the second trimester and the first half of the third trimester is considered the safest to see the dentist.
All right, you can check out Dr. Haas's book, If Your Mouth Could Talk, to learn even more.